Dr. Cole. Hey, what'd you do to your hair?
Like it?
Paging Dr. Cole. Paging Dr. Cole.
Hello, Dr. Cole. Why didn't you wait for me?
As a doctor, you're precise. But as a wife, Maggie... Well, Maggie, you're a wife.
Better be careful. Briggs listening.
How long does it take you to get a haircut anyway?
Do you want to talk or do you want to look?
I'm afraid to. I might hate it.
Tough?
That attitude won't get you up in this gorgeous sky, Maggie.
Maybe not. But I can think of plenty of ways to get you back down.
I'll bet you can. Say, I got an idea. Why don't you stand out in the middle of the field, and I'll come in low, drop you a grappling, and then all you...
Ben! Hey, Ben, I'm not receiving. Ben? Ben? I'm not receiving.
Now listen. I'm going to bring the plane down. I want you to get an ambulance.
Ben?
Call an ambulance. Maggie.
Brig, an ambulance, quick.
It's coronary. Oh, God. God, it hurts, Maggie. Keep talking to me.
You talk, Ben. Don't let it knock you out. Keep talking, Ben. Breathe deeply, Ben. Now just relax.
All right. Now, I'm going to head north toward the mountains. And come back low.
Easy. Easy does it. That's good.
I just think it'll teach me to be more patient. I should have waited for you. I could be home painting the den. Yeah, there's plenty to do there now.
Ben! Listen to me, Ben. Ben! Pull up, Ben! Pull up! Ben! Listen to me! Ben, pull her up! Ben, you're coming in too low! For God's sake, Ben! Ben, you're too low! Pull her up! Ben! Ben, you're too low! Ben! Ben! Ben, pull her up! You're too low! You're too low!
I love you here, Maggie.
When I close my eyes, I can see your face. Though I try, I can't believe that you are gone. There's a part of you that's a part of me, and no matter where I go, it comes along, reminding me of all the good times, and of course some of them. But then again, some of those hard times were the best we ever had. How can I learn to say goodbye to the
Maggie? You haven't been sleeping. Eating?
You know me, Hank. Nothing keeps me from feeding my face. It accumulates.
That's only Ben stuff. I told him not to pack yours because, I want to try to talk you out of it.
Thanks, but no thanks.
Maggie, you're a brilliant researchist.
Adequate, that's all. You know, I've been thinking things over lately, and I don't know if I've stayed here for 15 years out of love for my work or love for my husband.
It doesn't really much matter.
It matters to me. I've lost my taste for it. I thought after a few weeks, a month, I'd relish coming back. I don't.
Take more time.
I want to work. I can't hold myself up in that house anymore.
Maggie, I'll throw so much work at you that you'll beg me for a day off.
Not here. Not when I have to pass that office across the hall and see a new name on the door.
Where are you going?
There's a doctor in Chicago. He wants someone to take over his practice for a month.
You haven't practiced medicine since you've interned. Now, what are you trying to do to yourself? Maggie, Ben is gone. And you're not going to change that fact by getting yourself in over your head in the medical practice any more than you could by hiding out in your house. Stay here, Maggie.
Slowly. Lady, move back. He just wants to get out the door. Lady, I like my patients to come in here to get cured, not killed.
I'm not a patient. I'm Dr. Cole.
You're a doctor?
I'm a doctor.
Great. You're just in time to sew me up. Come on.
I want a policeman.
I'm rusty at showing lacerations.
I'm not. I'll show you how. Top shelf of that cabinet. Fergie!
I assume you're Dr. Grasso?
Grazzo, like in fatso. Call me Lou. You, Margaret?
Maggie. With or without adrenaline?
Without. Man, come on, Fergie. Sutures, huh? That was a dumb thing to do. Did you know enough to stay away from an acid freak?
You're the one who got stabbed.
Oh.
Need some help in here?
Yes.
No.
I haven't sewn a laceration in 15 years.
So. Oh, that swaps. You like horses?
My husband did.
I can't stand them. But I love gambling. You'll be on duty 24 hours a day, 7 days a week. Now, that means house calls in the middle of the night on deserted streets and you all alone.
You tried to scare me off.
You want to do it?
You sound as though you're practicing in a different century.
I'm a GP who's practicing my own way. Right here.
Runs on third, counts 3 and 2. 2 outs.
Right
be going.
now.
Here's the pitch. He struck him out.
Yeah. Well,
I'll stay.
why?
I want to work.
You want to work? Says here that you had a nice cushy job in research. 5 days a week, 9 to 5. What are you doing here?
Are these routine questions? Or do they just apply to women? Your ad said you needed someone for a month.
Yeah.
I can always fly back to L.A.
Okay. Fergie! You got a car?
I'll rent one.
Yeah. You got a place to stay?
Checked into a hotel.
Patients are getting restless.
Yeah, I know. Fergie, meet Maggie Cole.
Hi.
Hello.
Take Maggie and show her her office and put her to work.
You mean right now?
Right now. People out there who are hurting.
When are you going on your vacation?
When my car's serviced. Maggie, I need someone who'll stick with it.
Doctor, when I was 7 years old, I hated string beans. One night, my father forced me to eat them. 2 hours later, I got in his new car and threw up.
All right, next.
Fergie, I have a confession to make to you. I haven't practiced medicine in over 15 years.
None?
Mm.
Your feet cold? Hey, now. It's easy. Half of these patients just need a smile and a sympathetic ear. As for the rest of them, just remember 2 principles. If you don't know, look it up. If you gotta treat, then undertreat. There's nothing worse than a patient who's sick from the doctor's medicine. Anyone who can sew a laceration the way you did has got no call to worry.
Oh, I've been practicing on patchwork quilts.
Mr. Alessandro!
Presente. Meno male. Buongiorno.
Hello, Mr. Alessandro.
It's a woman.
This is Dr. Cole.
I want to see Dr. Lou.
It'll be a long wait.
All right, I'll wait. Scusi tanto, signorina, dottore. Cosa vuole? You don't understand what I say, and I don't understand what you say. Because I'm stupid. Arrivederci.
Ciao.
Ciao. Ciao.
Hi, Fergie.
Hi, Lisa. How much time have you got?
15 minutes.
Good, you're next.
Say, I like your hair.
I don't. I'm going to cut it short someday and tease it into an afro.
Wouldn't try it if I were you, honey. Never seems to work on blonde hair.
Did the new doctor get here?
Mm-hmm.
Is she old?
No.
Pretty?
Mm-hmm.
Hip?
You tell me.
Help. Can't read the writing.
Phenylbutazone.
Thank you.
Dr. Cole, this is Lisa. She runs Dibble's Soda Fountain.
Oh, great. I'll be needing your services in just about an hour.
Well, what do you think?
I like it.
So do I.
Is it okay?
Okay. Now, Lisa Lovely, you go on home. You take one of those pills every day, you hear me? And I'll see you next week.
Bye. Gotta run.
Bye.
So, how's our doctor doing, huh?
Mrs. Jacoby tried to fix her up with Harvey.
You're kidding.
Is Lisa holding on?
Okay.
It's been 6 months, Lou. Do you think she could be all right?
It's leukemia, Fergie. A little science and a lot of luck. So far, so good. So far.
Dr. Maggie Cole. Maggie, this is Ivan Dvorsky.
Doctor.
Dr. Ivan, known to his dental patients as Ivan the Terrible.
Hi.
Hello, Ivan.
Nice teeth.
That's his entire contribution to conversation.
And this guy's name is Isidore Glass. Guess what he does for a living?
Isidore. Eyeglass. Optometrist?
My parents planned my future at birth.
Hi, Lisa.
Hi.
Lisa, what's the word for today?
Incipient.
Meaning?
Beginning, in an initial stage. Like incipient glaucoma.
Or incipient starvation.
Lisa learns a new medical word every day. She plans to take over Lou's practice someday. Right, Lisa?
Right.
Deep breaths. A lot of congestion in there. That suggests bronchitis.
Is it serious?
Not too bad. Put your clothes back on. I'll give you some medicine to clear it up. Mrs. Barone, I thought you'd gone.
You told me to wait right here for my pills.
Oh, I'm sorry, I forgot. I got tied up with another patient. I want you to take one of these pills every day. Come back and see me in 2 weeks. Meantime, take care of that baby.
Thank you, Doctor.
Dr. Cole. The pharmacist wouldn't fill this prescription.
Why not?
It's for a child. You prescribed an adult dose.
Sorry. Call and thank him.
Don't thank him. He was doing what he was trained to do.
Maybe that's what I should do.
Mm-hmm. There's 14 patients waiting out there.
I'll get to them.
That man on the couch over there with the red hair, that's Mr. Hazen. He's going to burst a bladder if you don't pass a catheter on him real soon.
Anything else?
Hospital rounds at 5. That'll give you 2 hours to clean up the rest of the people.
You know,
I've got things to do. Mr. Coleman next, please.
come on in.
Late out for having dinner, lady.
I'm afraid I'm just going to have to get used to it.
You know you're on the chef's hate list. Supposed to go home a half hour ago. You know what I mean?
Hello? What? I'll be right there.
Just relax. Relax, Mr. Pearlstein. Just take it easy. Rose!
As soon as I could.
Man has a acute pulmonary edema. Rose, hurry up with that bucket!
Can I help?
I'm going to bleed him.
Don't you use epinephrine?
Not enough time for it to work. Just relax, Mr. Pearlstein. Just relax. Rose! Almost. Just relax, Mr. Pearlstein, huh? Okay. All right, boys, take it easy. Take it easy. Easy, easy. I'll see you in the hospital, Mr. Pearlstein. Where's your car?
Right here. Sorry, Lou. Didn't realize that hotel was so far away.
I told you I was a street doctor. That means I get to the patient before the ambulance does.
I'll find some place closer in the morning.
What do my patients do until then?
I'll sleep in the office tonight.
Fine.
Look, I may stumble a lot, but if you're waiting for me to fall on my face, it's not going to happen.
Is car rented?
Mm-hmm.
It's a good thing. You just had your hubcap swiped. Have a nice night.
Good morning. How was your night?
How does 7 house call sound to you?
Good. Less than usual. Did you kill anybody?
Sure hope not.
That's even better. I see you moved in.
Only for the night.
Did Lou give you his street doctor speech?
Uh-huh. I didn't really mind the move. One night in that hotel, and I felt like I was up for grabs.
Don't I know it. My man passed on over 10 years ago. And I've got family who still give out my number to every dude over 50. They take one look at my 7 kids and it's goodbye, Fergie. Got any kids?
No.
That makes it easier. And harder. As much as I bellyache, I look at those kids of mine and see my man in them. A little bit of face, a move, a laugh. God bless them. They're the beginning and end of me. How about some coffee?
Good idea.
A couple of patients out there, but they can wait.
Looking for a place to live?
Uh-huh. Oh, it's a bore.
A house?
A clean room with a clean bed.
I know where there's one and it's only 2 blocks away.
Have you seen it?
I live in it. It's my grandma's.
I'll take it.
Really? It's not very fancy or anything.
When can I move in?
Tonight? Right now. I'll take you there.
Mind if I finish my coffee first?
Oh, I'm sorry.
I'll drink it fast.
The word is involution. It means involving, entanglement, curling inwards. Like involutional melancholia, when a person gets depressed and curls up inside himself. I guess like hiding.
How long have you been learning your word a day?
Almost a year. I made a resolution on my birthday. Well, here we are. What do you think?
You know, I used to live in a house just like this when I was about your age.
Come on.
I just had it painted and wallpapered.
I can smell it.
Well, you can open the windows and air it out.
Grandma, she likes it. You do, don't you?
Uh-huh.
It's $20 a week. In advance. And I want a week's notice if you're moving out.
I'll take it. Could I have my own key to the front door?
Well, I'd have to have a new one cut. That'd cost me 50 cents.
I'll be glad to pay for it.
I don't like that face, young lady.
Sorry.
I'll have the key made for you. And you better get on back. Mr. Dibble's going to get a new girl.
Don't mind her. She just doesn't care too much for lady doctors. And she's old.
But being old's not a disease.
It is with her. Come on, I'll show you my room.
Do your parents live here?
No, they're dead. Come on.
Maybe we better wait for Dr. Lou. I mean, he knows us and...
I know. But he's away for the afternoon, and I don't think it's a very good idea to wait too long if you're worried. Now, suppose you tell me the rest of the story, and then I can talk with him about it.
Well, like I said, Al has his spells, and it's like an amnesia. I mean, he just doesn't remember certain things.
How long do these spells last?
About a half a minute. And then he has these, like, temper tantrums. I mean, that's the only way I can describe them.
Do you remember these temper tantrums, Mr. Anderson?
No. I just feel my face getting all hot, and my hair seems to stand up on end, and some of the boys down at the plant say that my face turns all red.
Have you seen this?
It's just like the blood just all rushes to his face.
Mr. Anderson, why don't you step into the next room and I'll examine you?
Go on, Al. Go on. Sorry. It's like pulling teeth to get him to a doctor, and he just wasn't expecting a woman.
That's it, Mr. Anderson. Deep breaths. Deep breaths. How do you feel? Mr. Anderson? Mr. Anderson? Mr. Anderson, how do you feel?
I'm okay.
Let me help you out. Sit here for a minute and then put your coat on. Mrs. Anderson, I'm going to put your husband in the hospital.
Oh, is it serious?
No, it'll be all right. Don't worry about a thing. You take him on home. I'll call the hospital, arrange for a room, and I'll be in touch with you when it's all set up. Here we go. There. Oh, thank you, Doctor. You're welcome.
See you, Doctor.
It's not a large hernia, but it should be attended to. I'll put you on the list for elective surgery. Outside of that, you're in good physical condition.
Thanks, Doctor.
You're welcome.
How'd it go?
Bad, not bad.
How you doing?
Oh, fine, just fine.
Uh-huh. I got a call from Miss Anderson. She's a little worried about her husband.
So am I.
Yeah, well, I figured that. Maggie, what kind of a diagnosis is uncinate fits?
But it's a seizure that suddenly...
Oh, I know what it is, Maggie. I know what it is. But what kind of a diagnosis is it? I mean, uncinate fits is for animals. I haven't heard that term since I was in medical school physiology class.
It applied in this case.
Maggie, this is a medical practice. It's not a research institute.
Would you have preferred me to call it psychomotor epilepsy?
I would have preferred it if you'd talked to me first before sending one of my patients into the hospital as an emergency.
I thought it was an emergency.
Yeah, I think we could have waited a little while.
Doctor, I examined the patient, not you.
Uh-huh. Maggie, do you have any idea how much it's going to cost the Andersons to spend that time in the hospital?
I was thinking of what it might cost them if he didn't go into the hospital.
Well...
Did you cancel that bed?
No, I haven't. Not yet.
But you intend to?
Well, I was thinking about it. I want to talk with you first, Maggie.
No, Doctor. I want to talk to you. When you hired me, you knew my sex and my background. So there were no surprises when I walked through your door. But you've been on my back since day one. Now you can fire me. But don't sit on me. I won't accept that. There's a difference between being helped and being put under glass like some insect who's under inspection. If you're worried about my competence, I'll leave. If you want me to stay, I'm in charge. Your decision, Doctor.
Mm-hmm. Well, I won't cancel the bed.
I'd like to know when your vacation starts.
As soon as my car's serviced.
I like your hair shorter. I think maybe I'll cut mine too. Is this your husband?
Yes. What do you think of him?
It's okay, I guess. He looks a bit square.
Oh, that's just a disguise. He wasn't square underneath.
Is he dead?
Yep.
I think I want my husband to have long hair. Maybe down to his shoulders.
And maybe by the time you're ready to get married, long hair will be considered square.
I would never marry a skinhead. Have you got any children?
No.
Didn't you want any?
It didn't seem important at the time.
Boy, I want them. Even when I'm a doctor, I'm going to have them. Maybe even if I don't get married. Does that blow your mind?
Nope.
If I ever said that to Grandma, she'd wash my mouth out with soap. But like I said, she's old.
Well, now, I have a sister who isn't old, and yet she'd do the same thing. Do you think we could rustle up some coffee?
Sure. You stay here. I'll have to be real quiet or else all hell will break loose.
Is it going to be any trouble?
No, it's no problem. It's just a tactical maneuver. See ya.
Maggie, relax, Fergie. It's only 8 o'clock.
Lou just called. You've got to get to the hospital right away.
What's the matter?
It's the Anderson case.
Report to the nursing supervisor.
I'm an observer. They called me, I called you.
Miss Johnson, please report to the nursing supervisor.
I gave him intravenous Dilantin to knock him out. He had a grand mal seizure, Maggie. You were right, I was wrong. You want to write new orders, Dr. Cole?
We'll keep him on maintenance Dilantin and phenobarb. And I'll want a pneumoencephalogram. Have you called in a neurosurgeon?
No, it's your case, Doctor.
Well, what do you usually do?
Well, I never play the long shots. I only bet on a sure thing.
We called in a neurosurgeon.
Sweeney.
Looks pretty. Looks pretty enough to be normal.
Is it?
Yep. Want some gum?
My patient's not normal.
That's true.
What now?
Now, we try a carotid angiogram and see what we can find. Day after tomorrow.
Why not tomorrow?
No operating room's available.
Ugh.
You get used to it.
I'll never get used to it.
Hey, see this hand? What do you see? Long, delicate fingers? No. When I told my mother I was going to be a neurosurgeon, she got sick. I mean, my own mother got sick. She wouldn't trust these hands to put on a Band-Aid. But I'm going to tell you something, baby. I am the best neurosurgeon in this city. You know why? Because I stay calm. You know how I stay calm? I chew 10 packs of gum every day. I keep my mouth so busy I don't have time to worry about not having operating rooms available when I want to operate.
I get the message. What do you think my patient's got?
I'll know after the angiogram.
You'll know. What do you think?
I think he's got a brain tumor. What do you think?
I hope we're wrong.
That's nice, Maggie. You hope. You hope my mother gets sick. I'll stay calm.
IV nurse. IV nurse. Please call the blood lab. Call for Dr. Stern.
Mrs. Anderson.
Dr. Stern. A call for Dr. Stern.
Did you see the x-rays?
They're normal. We're going to do a different kind of x-ray day after tomorrow.
But I thought you said that...
With this kind of x-ray, we inject a dye into the blood, then take pictures as it disperses through the brain.
Oh. Well, then there still might be something very seriously wrong with Al.
We won't know until we see the new x-rays.
2 days. Doctor, if there is anything seriously wrong with him, will you tell me and not Al? I mean, he just... Well, he's very strong about things like this. I mean, I always called him my fifth child, you know. 3 boys, a girl, and Al. Mm. And him the biggest baby of them all. In some ways.
I know. My husband used to love those toy rubber things like tarantulas, black widow spiders. Sometimes I'd find one on my pillow slip. Sometimes under my dinner plate. A joker. A joker. Well, what do you think?
I like your earrings and pin, but the dress doesn't knock me out. I think if you're on a date, you should show some knee.
This is not a date. It's a business meeting.
It's with a man that makes it a date. Come on, show some knee.
Frankly, my knees aren't what they used to be. What's the word for today?
I haven't gotten to it yet. I'm dragging. I must have walked 20 miles behind that counter today.
Well, you do that every day. I think you're copping out.
I think you're getting hip with the lip.
You do look tired.
I told you.
You feeling all right?
Sure. There's your date.
I'll see you later.
If you won't raise your skirt, maybe you could just lower your neckline a bit.
Good night. So there's Ben. Dead tired at 4 o'clock in the morning with this man who's obviously a hypochondriac. The man screaming, yelling, cursing at the top of his lungs. And he refuses to leave until Ben gives him an injection.
Oh, yeah.
Now, if you know Ben, you'd know that he's never stuck for an answer to anything. So he says, just a minute, be right back. Goes into the next room, comes back with this huge fake syringe with a needle that's 10 inches long. Says to the man, I'm ready if you are, drop your pants. The man takes one look at this needle, makes a beeline for the door, knocks over 2 surgical tables on his way out. Ah, those were great days.
Yeah.
You know, we've been here almost an hour, and all I've done is talk about myself.
No, not quite. I know a lot more about Ben, though.
Well, maybe that's because he was always the best part of me.
Mm-hmm. Tell me, you given any more thought to staying in private practice?
Is that what this dinner's all about?
Well, I've been watching you.
So I've noticed. You have no intention of going on that vacation, have you?
Oh, yeah, sure. As soon as my car's serviced.
What do you drive, a 747?
Oh, come on.
By the way, how many doctors have you played this little game with?
About a dozen over the years. They were all quitters. You haven't answered my question, Doctor.
I've thought about it.
And?
Why are you in it, Lou? Like this, I mean. It's not a vocation with you. It's more like a lifestyle.
Lifestyle? That's funny. Yeah, well, maybe you're right. Maybe that's what it is, lifestyle. You know, I'd be bored to tears doing anything else or practicing medicine any other way. So I like the action. You know what I mean? I like not knowing what's going to happen next. I like not knowing who's going to come in that door next. I like not knowing who's going to be on the other end of a phone when it rings. It's exciting. You know, it's like my gambling, huh? Even the pain. And there is pain. But it's the pain that tells you whether you're alive and kicking or not. Hmm? You know, maybe that's why I never got married. I really like my freedom. You know, I think we'd better order, or they're going to kick our fannies out of here.
My call or yours?
What difference does it make? We've only got one car. I'll ride with you. You take my car, I'll meet you there.
My God, she's lost her left leg.
She probably has. She has acute myeloblastic leukemia.
100 over 55.
That's good. She's coming back. When we finish this bottle, we'll switch over to a 5% glucose and saline solution.
Do you want to write lab orders?
No, Dr. Cole will take care of that. Dr. Cole?
Why didn't you tell me about Lisa?
When? I've got 2,000 patients, Maggie. She's special, of course, but she's only... I didn't know you were personally involved. Are you? Oh, boy. I'm sorry.
When did you make your diagnosis?
8 months ago. I put her on mercaptopurine, and she's been fine for the past 5 months.
Does she know anything?
No, I didn't tell her anything, but I'm sure she knows. I mean, she's too bright not to figure it out for herself.
Then all this word-a-day game, wanting to be a doctor, marriage, kids, the future, that's all just make-believe, huh?
Maggie, like a lot of us, she creates her own needs.
I wish I had a cigarette. 6 years without smoking, and I still haven't gotten it out of my system.
Mm-hmm.
Lou, I'm taking myself off this case.
If that's the way you want it, Maggie.
Excuse me, Doctor. She's asking for Maggie. Do you know who that is?
Sure. She's asking for Maggie, not Dr. Cole. I'll write the lab orders, nurse.
I hate transfusions. I'm afraid they're gonna give me the wrong bottle of blood. How many bottles did you give me?
That's your third.
Last time I had 5. Are you gonna give me mercaptopurine again?
I don't know. Dr. Lou's writing orders now.
Well, you're gonna take care of me, aren't you?
Yes.
I'm tired.
You get some sleep. I'll see you in the morning. See you.
Housekeeping manager. Housekeeping manager, please report to the 5th floor.
It's my case, Lou. Come in.
I thought maybe you could use a cup of tea.
Oh, thank you, Mrs. Downey.
I took a chance and put sugar in it. I didn't know how you'd take it.
Sugar's fine, thanks.
How's Lisa?
Miss Downey,
Oh, Dr. Lou told me that she has leukemia 8 months ago.
We replaced the lost blood, and we're starting treatments in the morning. Come on, sit down for a little minute.
Thank you. Did she ask for me?
Yes. Yes, she did.
You're not a very good fibber. I guess she thinks I'm just a mean old lady. Maybe I am, I don't know. Maybe meanness is all I got left to keep me going. Oh, you get old, people die all around you. Your friends. Your family. I buried my husband. I buried my son. And now with Lisa. Do you know what I mean? I keep hearing myself say things to her that I don't mean to say. And I just can't stop myself from saying it. I look at that child, but I don't see her face. I just see another funeral. I love her. She's my blood. But I just see another funeral. Now, any time that you want another cup of tea, you go on out in the kitchen and help yourself.
Maggie? You all right?
I'm fine.
What time is it?
6 o'clock in Chicago.
6. Maggie, it's 4 o'clock in the morning.
The rates are cheaper. Hank, I need a favor.
What is it, money, so you could afford to call me at a decent hour?
I want every drug you've got that's showing promise in the treatment of acute leukemia.
What are you doing, starting your own research program?
I need it for a patient.
We haven't got a thing we've tested on humans.
I know that. I want it anyway.
Maggie, I can't authorize that.
If I don't need it, I won't use it.
Look, it could blow up in your face. You could lose your license and get slapped with a lawsuit.
I'll take the gamble.
Well, I won't.
Look, Hank, I can't lose this patient over a possible lawsuit and a loss of license. Send me the best thing you've got, and I promise you that nobody's ever going to know where it came from. I'm begging you, Hank.
I'll see what I can do.
I'll expect it on the next plane. So long, Hank.
Wait. Maggie? Maggie?
I'm Dr. Cole.
Oh, hi. Here's your bone marrow on Lisa Downey. Her blood smear showed stem cells and a marked decrease in the platelet count.
I started her on 6-mercaptopurine.
Well, it worked once, but I wouldn't bet on it's working again.
Any other suggestions?
You might try the antifolic acids.
I intend to. Every one of them.
That's the 5th bottle.
How are you feeling?
My head hurts.
I brought you something.
Thank you.
Take a deep breath. Again. Need anything?
No. Can you stay and talk for a while?
I have to see Mr. Anderson. But I'll be back later. Okay?
Okay.
Right there is Mr. Anderson's problem. It's a tumor, all right. Now, it seems to have a well-defined capsule. That's the best news yet.
Meningioma?
Could be. Want some gum?
No, thanks.
Now, if we're real lucky, it's benign.
How soon can you go in?
Tomorrow. I figured it might be this, so I booked the OR at the same time as I booked the angiogram. Clever?
Oh, clever.
Wish my mother would think so.
Is it cancer? I don't think so. But we can't be certain until we operate. Then operate. Would you like me to talk to your husband?
No. I'll tell him. You see, I'm going to lie to him. He'll understand that better. There's no use both of us worrying. Thank you, Doctor.
Special delivery for you.
Oh, thanks.
Are you ready for the next patient?
Mm-hmm.
You gonna scrub with Sweeney tomorrow?
Well, I think I should.
What's that?
A vial of hope.
For who?
Me.
It'll be fine, Myrna. Don't you worry.
He knows.
Let's have some suction, please. I'm down to the dura now. Suction. Oh, lovely. Lovely, nice little capsule here. No adhesions on the exterior aspect. Oh, God, why didn't you give me long, slender fingers like Isaac Stern? Smile, Maggie. 50 to 1. It's a benign meningioma. Somebody ever tell you got great eyes?
And I love your stubby little fingers, too.
Her hemoglobin's still 7 grams and her temperature is 100.2.
What's the latest blood report from pathology?
Dr. Edmonds called. He says no change.
Thank you, nurse. Good morning. You still having those headaches, Lisa?
Yes.
Deep breath, Lisa. Deep breath.
I don't want any more blood.
You only get it if you need it, Lisa.
I don't want any more.
No, absolutely not.
I have nothing else to give her.
She's no guinea pig.
Go take a look at her. Look at her blood smears, her bone marrow. Check her hemoglobin, her bleeding time. Then talk to me about guinea pigs. None of the drugs have worked. She's bleeding into her skin, into her intestines. What do you want to do? Watch her die? I don't know if this new drug will work, but at least it's new. And she has nothing else, Lou. Nothing.
I'd have to get it okayed by the chief of medicine and the hospital administration.
Then do it. Damn it, you're a gambler. Gamble. How's the patient?
All right.
What's her hemoglobin?
11.5. Almost normal.
Aren't you glad to see that intravenous going out that door? Are you angry with me?
No.
You say no as though it means yes. Want to talk about it?
I learned a new word.
Induration. The quality of being hard. The process of hardening. Lisa,
I'm still a person. I have a disease, but I'm not a disease.
Oh, Lisa. I'm sorry. I'm sorry.
Look, will you stop bubbling over like a first-year medical student and give me a clinical evaluation of the stuff?
The stuff is amazing. She's been on it for nearly 2 weeks, and her blood picture and chemical profile are near normal. She's even gained a few pounds.
You're sounding too optimistic for a researchist.
I'm not a researchist. I'm a physician. And don't lay your professional hat on me. I'm here, mister. I'm seeing it.
Oh, just don't get carried away.
Don't worry. My feet are still on the ground.
Well, when are you coming back where you belong?
I don't know that I am.
What do you mean?
I mean, I still haven't decided where I belong.
You know we'd like you back.
I know. Thanks, Hank. Give my love to all the gang.
Bye, Maggie.
Bye-bye, Hank.
Hank, as of yesterday, we've lost close to 1/3 of our animals. I'm beginning to wonder if that drug isn't just a deterrent.
Well, maybe, just maybe, it'll work on humans.
Why didn't you tell her?
Of course, I want her to have better luck than we've had.
Remember the other day you were asking about when Ben and I were interning? Well, we used to have this dinner pool. The food in the cafeteria was so awful, you just couldn't eat it. And we'd pool our money and send out for things like Chinese food, pizza, fried chicken. And then we'd all march down to the cafeteria and use their forks, their knives, and their plates. Oh, did they hate us.
I learned a new word today. Intussusception. Intussusception. It means the telescoping of a portion of the intestine into a distal portion, resulting in obstruction.
Oh, that's good. Very good. But hardly a topic for discussion over dinner.
When you were a kid, did you ever faint over the sight of blood?
Every time. How about you?
When you see so much of it, you get used to it. Maggie, you know what I'm afraid of? My dictionary. I'm afraid of getting to the L's.
Aim past that, Lisa. aim for the Z's. That's the one I delivered.
He's beautiful.
Naturally. I only deliver beautiful babies.
Then you can deliver mine.
After you're married.
Prude.
Want to buy them?
But don't they belong to somebody?
I repossessed them.
You what?
I repossessed them. The patient owed me $200 and he refused to pay me. So I went to his house with a bailiff and I took them right out of his mouth. His dinner was on the table. Steak. He wasn't eating any steak with my teeth.
Ivan, you're a liar.
Maggie, let's get to the hospital.
What is it?
Let's go.
She's comatose, Maggie.
Edmonds, please.
She's bleeding intracranially.
Can't you do something?
There are no localizing or lateralizing signs. It's a diffuse bleed.
You can do something. What about burr holes?
Where should I put them, Maggie?
You're the greatest neurosurgeon in the world. You tell me.
I never claimed to be God. This is a leukemic process. Your drugs run out of steam.
Lisa Downey, what's her platelet count? Bleeding time? Thank you. Edmonds says that her platelet count is 0. Can't even get a bleeding time on her.
Then she's gone.
I'm all right, Lou. Let me go.
Where are you? Where do you think you're going?
I don't know.
That's right. You don't even know where you're coming from. Now, you get back up there and deal with your patient.
My patient is dying.
That's right. Your patient is dying. And she's unconscious, and she may never regain consciousness. But if she does, you know who she's going to be asking for.
I can't.
You can't. You mean you won't.
I won't bury another one. It's too damn much.
You haven't buried anybody. You just ran, Maggie. You ran and you ran and you ran, and you ended up hiding right here. Your husband is dead, Maggie, and you haven't even faced up to that. You gonna do the same thing with Lisa? Where are you gonna run to then? Oh, Maggie, Maggie. Take a risk. Don't you know that's all the difference between being alive and being dead? Take a chance, girl. Take your lumps and learn to say goodbye.
everything is coming to an end. They say the time is all that matters, and to live it well and lasts. But I can't stop from reminiscing or stop living in the past. How can I learn to say goodbye to the only life I ever knew? Learn to say goodbye to you.
Lisa. I'm here, Lisa. I'm here. Mommy. I'm here.
Mommy. Mommy.
I'm here.
Mommy.
Really loved that girl, Lou.
You gonna stay with me, Dr. Cole?
Until you get your car serviced.
I'll buy you a cup of coffee.
Give me a minute.